All right. Hi,
Okay.
everyone. Thank you for joining us on our second edition of Healthier You virtual from Oswego Health. We're here today to talk with you about colon cancer. March is Colon Cancer Awareness Month, and we like to get more information out about that. I'm Katie Peglaroli. I'm the Director of Quality. Used to be the Director of Quality and Patient Safety. I'm the Corporate Director for Integrated Healthcare here at Oswego Health. I'm here with Dr. Tull, who's our Chief Medical Officer and General Surgeon, and here with Dr. Ajoy Roy, who's one of our gastroenterologists. And we're happy that you joined us today. We're going to go through a few questions, and we do have some time. If you have any questions, make sure you chat to us. Let us know that you're here. Thank you both so much for joining us. I know that you have very busy schedules, and we thank you for taking the time out to talk to us today about this important topic. I'm going to start with a couple questions. Dr. Roy, I'm going to start with you. We've recently started hearing a lot more about colon cancer in the news. What is colon cancer and what are some of the risk factors?
Yeah. So the colon cancer is a cancerous growth inside the colon, which is your large intestine. And it's the second commonest cancer killer in the United States. The thing about colon cancer is that it's one of the cancers that can be prevented. So we understand the difference between early diagnosis and treatment and prevention. A preventable cancer is something that you never got cancer. 97% of colon cancer start out as a polyp. And if you detect a polyp and remove it, then the person does not get cancer. So it's a preventable cancer with a colon screening, so that's one part. The second part is that most colon cancers are going to happen in people who do not have any risk factor. So you should not look at yourself as somebody who doesn't have risk factors, so you shouldn't go for colon cancer screening. However, there are conditions that increase your chance of colon cancer. Commonest of them is the family history of colon polyp or colon cancer. You're 3 times more likely to have colon cancer or colon polyp if you have the same in your family. Okay. The second commonest is inflammatory bowel disease, which is ulcerative colitis and Crohn's disease, more Crohn's colitis, but any of these increase the chance of colon cancer, such that with ulcerative colitis, with 20 years of active disease, 1 out of 10 people are going to develop colon cancer. The third factor is different kinds of polyposis syndrome that runs in the families mostly. And some of them, like familial adenomatous polyposis, have almost 100% chance of giving you colon cancer unless you make the early diagnosis and get rid of that colon. The colon cancer is one of the conditions that does not give you any symptom until it's too late. If you're lucky, you may have some bleeding or you may have some bowel obstruction symptoms, but most of the time you'll have no symptoms. You'll present with anemia or bowel obstruction when your tumor has already spread to different areas. So you should not wait for a symptom to show up before looking for colon cancer screening.
Thank you so much. That's such an important point that brings us to our next question. There are not really those symptoms that show up early. So Dr. Tull, we talk about that. People need to be screened for colon cancer age 50. What are ways that you can get screened for colon cancer?
Yep, the gold standard for screening, of course, is a colonoscopy. With a colonoscopy, we're able to visualize the entire colon. And if we find polyps, we're able to remove them at that time. That way, it is also a screen as well as a possible treatment and prevention of a future colon cancer. There are virtual colonoscopies that can be done on the CT scanner. You still have to do the same prep, and you take dye, which then visualizes any abnormalities. If that shows any abnormalities, guess what? You get to have a colonoscopy. There's the new DNA test, which everybody hears about. These DNA tests, you give them a sample, it gets sent off to the lab. The lab tests it to see if you have DNA suggestive of polyps. And if it comes back positive, best recommendation is a colonoscopy. We also have fecal immune testing and hemocult testing. Both of those simply say whether or not there are abnormal cells. And again, if either of those are positive, you definitely end up recommending a colonoscopy. So again, the gold standard is colonoscopy, and we currently recommend colonoscopy every 5 to 10 years for people with no polyps. We recommend 5 years for people who have a few polyps, and we recommend 3 years or less for people with many polyps.
Thank you. So really,
If I could jump in with one more information, is that the DNA testing, the so-called Cologuard test, that has been evaluated mainly for colon cancers. So that 95% value that they look at is when a person has colon cancer. Now, the purpose that we have in colon screening is not to get colon cancer and then treat it. That's early diagnosis. That's not prevention. We want to find a polyp before it turns into cancer. And that way, that differentiation should be made. Yes, some of DNA abnormalities do come out in the polyp stage, but it has not been evaluated so far as to accuracy in detecting colon polyps. The evaluation has been for detecting colon cancer.
thank you. So what I hear you saying is that if you want to prevent colon cancer, you need that screening to remove any polyps. That
Right.
DNA testing will help you if you've already developed colon cancer, it may detect it.
Exactly.
Okay. So Dr. Roy, thank you. We're going to continue with you. Once your colonoscopy is scheduled, or if I'm interested in screening and need a colonoscopy, what should I do to prepare? What will I need to do?
Okay, so the colon screenings, it's a screening test. Your colon is between 4 to 6 feet long, and it's not a straight tube. It has a lot of folds in it. The test is only going to be as good as cleanliness of that colon. So getting that colon cleaned is the most important preparatory work. And usually it's not a pleasant thing. There are 4 or 5 different kinds of solutions that are given to clean, but it's always going to be a lot of fluid to drink, and it's not a very tasty fluid to drink. However, it is very important, depending upon your stomach, how good it tolerates anything. You can drink it slowly, but most important part is that you do need to finish your entire preparation liquid to make sure that what's coming out when you go to the bathroom is clear liquid. It can be tan, it can be yellow because it's bile and you produce your bile, but it should not have any particles. The second part to remember is that we do go prepared to take any polyp out, which is a little bit of cutting. So if you are on any blood thinners, they need to be stopped beforehand. Depending upon what kind of blood thinner you have, it may be anything from 2 to 5 days. And usually the instruction is given to you when you are scheduled for colonoscopy.
Great. So
yeah, the 2 more things is that you do need to be on clear liquids the day before procedure. On the day of procedure, before you come, you have to make sure that you are going to be not eating or drinking anything for 4 hours prior to your procedure time, because we do give medicine to help you relax, go to sleep, and anesthesiologists don't want you to have a full stomach at that time. So, and you need somebody to take you home and be with you, because you're not going to be fully alert to make all the decisions and to engage in activities.
thank you. So I think that's a really important thing for people to hear about. It's not as bad as people think it might be getting your colonoscopy. People get worried about that, but really it's about a day of prep, cleaning out your colon, and then the next day you'll have your procedure and they'll take any polyps at that time. And that kind of brings us to our next question. We talked about this a little bit, and I'll just add to see if you have any further thoughts, Dr. Tull, but this is a cancer that's preventable. We're hearing that from you today. So what are the things? The colonoscopy is really the main thing to do to screen for those polyps. Are there other things that we can do for prevention?
I mean, removing the polyps before they become cancerous is the only true prevention of colon cancer. We can do, normal bowel habits, keeping your stools regular, trying to avoid straining, trying to avoid damage to the colon is important as well, but the only prevention is removing the polyps before they become mutated and cancerous, which is why the screening is important, why you should choose a screening that allows for removal of polyps. In other words, you should consider a colonoscopy. And I will reiterate, I think all of us have been through this in one way or another. The prep is not as bad as people say it is. It is not the most tasty drink, but at the same time, it's important. It's important to get your colonoscopy, to get any polyps that are there removed, to prevent colon cancer.
Very good. And if you think about this, I'm here today with a general surgeon and a gastroenterologist. Gastroenterologists can do colonoscopies. They can also do other procedures. General surgeons, some do colonoscopies, not all. So make sure you check on that. If you need to get a screening, make an appointment, call and find out if the person that you're getting that screening from does perform colonoscopies. That's an important step of your overall wellness. Do we have any questions out there? We're going to ask. No questions. You guys answered all of our questions today. This has been very informative. Thank you both so much for joining us. Our next edition of Healthier You is going to be in April. We're going to talk about some common seasonal ailments that you might find as we head into spring. And if you were outside today, you might think we're headed there early. So we're happy about that. Hope you get to enjoy the sunshine. Here at Oswego Health, we're right at home.
Thank you.